Hi, my name is Charlotte Guertler, and I will talk about imaging of focused ultrasound-induced shear waves to probe mechanical anisotropy of tissue. Many biological tissues, like muscle or white matter in the brain, are both structurally and mechanically anisotropic. Understanding tissue anisotropy is important because anisotropy can influence injury mechanics or reflect tissue health. Despite its importance, mechanical anisotropy of tissues is still an active area of research. It is challenging to measure because its behavior is dependent on the direction and location of loading. One way to characterize anisotropic tissues is to use shear waves, which can be created using ultrasound. Ultrasound waves can be focused into a focal point. At the focal point, the focused ultrasound energy produces a relatively large acoustic radiation force that can move the tissue. We can investigate the material properties of tissues by using MR imaging of harmonic ultrasound-induced motion, or MR-hum. In this method, the high-frequency ultrasound waves are modulated with a lower-frequency square wave. This creates an amplitude-modulated force at the focus that can provide harmonic shear waves at the square wave frequency. The displacement of this harmonic shear wave can be measured by MR elastography using a phase contrast imaging sequence. Here we see the resulting harmonic displacements in an isotropic tissue. We can investigate anisotropy by looking at the shape of the resulting displacement wave. As you can see with an isotropic tissue, the displacement wave is circular. In a fibrous anisotropic tissue, the displacement wave is elliptical, with the semi-major axis along the tissue fiber direction. For this study, we performed MR-hum in fibrous muscle tissue samples in 13 experiments and a simulation. The finite element simulation was performed in COMSOL multiphysics using a nearly incompressible cylinder to mimic the anisotropic muscle tissue. For the experiment, cylindrical fibrous muscle tissue samples were embedded in gelatin. The tissue fibers were roughly 90 degrees to the direction of displacement and were vibrated at either 400 or 500 Hertz. This shows example data of MR-hum at 400 Hertz. The top row shows an experimental data set and the bottom row shows a simulation data set. The first column is the W component of displacement. In both experiment and simulation, we see elliptical waves, which are expected for an anisotropic tissue. The second column is the apparent shear modulus, or stiffness, which is calculated from local frequency estimation, or LFE. Apparent shear modulus varies relative to the fiber direction, with tissue appearing stiffer within 15 degrees of the fibers. The white lines in the image outline the area used to estimate the apparent shear modulus parallel to the fiber direction, while the gray lines outline the area used to estimate the modulus perpendicular to the fiber direction. The last four columns are the components of strain fields in fiber and non-fiber directions. Strain fields display directional dependence, with higher values of both tensile strain and shear strain in the non-fiber directions compared to fiber directions. Two ratios were used to quantify the effects of anisotropy. The first was the ratio of apparent shear moduli from LFE parallel and perpendicular to the fibers. The second was the ratio of strains along the fiber and non-fiber directions. All samples showed various degrees of anisotropy. Corresponding anisotropy ratios from the simulation are shown with red circles. The dashed green line shows the value expected for an isotropic sample. The two measures of mechanical anisotropy shown are not equivalent. The anisotropy ratios of apparent shear moduli from LFE are comparable to ratios of shear moduli from previous muscle tissue studies using other methods. In contrast, the ratios of strain in fiber and non-fiber directions from MR-hum are close to the previous studies that calculated ratios of elastic moduli. The large standard deviations and spread of anisotropy values from previous methods demonstrate the complexity of anisotropic parameter estimation compounded by biological variability. Ground truth material parameters are difficult to obtain, especially for biological soft tissues, which makes it important to compare results to simulations and among multiple approaches. In summary, MR-hum was developed to characterize anisotropic behavior of soft tissue. It is a non-invasive and non-destructive method that produces simple but rich shear wave fields that can be analyzed quantitatively. It can be readily simulated for comparison to experiments and validation of anisotropy estimates. This novel method can thus provide robust, non-invasive characterization of important mechanical characteristics of fibrous soft tissues. Thank you.